So I thought I'd give you a little bit of an overview at first of prison organizing, and then I'm going to talk a little bit about PASAN specifically and some of the pieces of work that we try to do and how we try to do that work. So although things were coming together, as Gary spoke about, around prison activism before 1991, 1991 was really when a small network was formed that came out of AIDS Action Now, and included people like Michael Smith and Julia Barnett, who some of you know, and it started in Julia Barnett's kitchen. And really that was all about coming together and talking about a group of people who had been fairly invisible to most of us doing AIDS activism work until that time. And that was people in prison. That they really, when they would go away, people would say, oh, you know, I don't know what happened to so-and-so, they're gone, right? I don't know what happened to them, I haven't seen them around for a while. And then they would reappear, and then they would go away again. There was so much discrimination and so around prison issues that people never even said, I've actually been in jail for a while. That wasn't spoken about. So a lot of groups saw this as a really important issue, and so there were groups like Black Cap, the Elizabeth Fry Society, the John Howard Society, and a number of other groups who came together and said, we really need to look at what's happening for people who are living with HIV and who are at risk of HIV when they are incarcerated. And that group came together and put together 40 recommendations for change to kind of look at specifically HIV and how that was really affecting people's lives in the prison system. At some point later on, we called ourselves PASAN. So this first brief that had 40 recommendations for change was really about prevention, it was about support for people living with HIV while they're in prison, and it was about advocacy. So it was really about that piece of change. And we really talked a lot about our three-prong approach and how important all three of those approaches were. So it wasn't about, we have to be an AIDS service organization, because we didn't have any funding at that time. It wasn't about activism alone, but it was about the combination of all those pieces. And really the centerpiece of that was the person living with HIV who was incarcerated. So for us, that was where that piece was the most important. How is this affecting people in prison? And what we saw was that harm reduction strategies were completely not happening at all in the prison system in 1991, 1992. There was no such thing as condom distribution in prison. There was no such thing as any kind of harm reduction tools, needle exchange, which still doesn't happen, as a matter of fact, in the prison system anywhere in Canada. And so there was a real, what we were seeing was this huge number of people who were invisible a lot of their lives and who were at huge risk for HIV, and as we came to realize, hepatitis C as well, and the issues were really linked. And the issues were really about poverty, the issues were about racism, discrimination, and homophobia. Like those were the huge issues that people were facing and looking at. So we established as an activist group, but also a prisoners' health rights organization. And although things have certainly changed, I'd like to say that some of those things are absolutely true today. So we started getting funding and started the incorporation process, which took quite a while. We started getting funding in 1993. We were funded by the City of Toronto AIDS Grants and the Ministry of Health Long-Term Care, the AIDS Bureau. And really was very little money, but it allowed us to hire one staff person. And so those of us who were on the first board of directors, I was one of the people who was on the first board of directors at PASAN, said, okay, we need to make sure that this one person really has to be implementing the brief. That's the idea behind it. So this brief with 40 recommendations for change is really the crux of who we are. It's our philosophy. It's what we believe. Harm reduction, working with people who are drug users, who are in and out of the prison system, their risk for HIV and hepatitis C. These are the things we really need to take into consideration. So clearly, and needless to say, it was an impossible task for one person. It's an organization that is provincial, which, you know, many people have calls. We collect calls, understandably, from across Canada because that's the only way people in prison can actually reach us, is through collect calls. And so we often get calls from people saying, I haven't seen you in my institution. I haven't seen you out in our organization. I haven't seen you, like, you're supposed to be a national organization, aren't you? And we're like, no, we're actually a provincial organization. Sometimes one of the worst things to be, I think, is a provincial organization, because people understand regional and people understand national, but the provincial is such an odd thing to be in so many ways, because we're located in Toronto, we travel a lot, but the reality is it's really difficult to pretend even to get to all the places in Ontario. We don't get to all the places in Ontario. We can't pretend that we do. We try to reach out, we do accept calls from all over, but it's a really difficult place to be. So by 1997, we had a collective of 5 staff to maintain and cover our 3 main goals, which we still continue: the prevention, support, and advocacy. So that was inherent in everything that we were doing. And that was the time when we really added hepatitis C as a main piece of what we were doing. And that was, again, from the people we were seeing in prison who were telling us, this is a bigger issue for us. You know, 30 to 40% of the prison population is living with hepatitis C, which is still true to this day. These are huge, astronomical numbers. And the vast majority of people we were working with, living with HIV, were co-infected with hepatitis C. And again, it's still true to this day. So, strangely enough, somehow we've grown to a staff of 14, and I say strangely enough because we don't fit really well with regular funding sources. This probably wouldn't be a surprise to you. We're an organization that really has kept advocacy in the work that we do. Absolutely, positively, we're there to do all the pieces of work: case management, support, trying to help people get housing and resettled back into the community when they come out of jail. We try to cover all those pieces, and the reality is that it's hard to cover all those pieces, even with 14 staff. And we know we're not always getting to do all of that. That we try really hard to reach out, and here's where partnership for us has been a really important piece, is that we know we can't do it all, we don't want to do it all. We are not the end all and be all of prison work. Lots of fantastic groups out there are going in and accepting calls, and that's what we want, that's what we want to see. So it's really important to us to say that, you know, let's hook you up with this group or that group because they have an expertise around Aboriginal issues, or they have an expertise for racialized communities. So we can't do it all, we don't want to do it all, and that's important for us to think about. But it also has been a barrier in terms of getting stabilized funding and really being able to do stuff like pay your rent and pay your staff. That's a constant struggle for us, because we don't always toe the line. From our inception, we've been a group that's been an advocacy-based group because of the systems of oppression that the people we work with are caught under, right? They are people who are locked up against their will in areas of confinement that take away their dignity, take away their access to family. So many women who have their children taken away from them. And really, I mean, you guys know this, I'm not saying anything new, but I think that you understand the complexities of the issues and who goes to jail, right? We're really clear about it is often people who live in poverty, the street-involved people, the drug users. Drug use is criminalized, so who goes in and out of the jail system is going to be somebody who's a drug user more often than not. People who are homeless with mental health issues, really complex issues. And HIV is one other amazingly important issue in their lives, but it's not the only important issue in their lives. It's the whole myriad of complex issues that are important to people. We're talking about a lot of different issues that people are facing and coming again, and I'm going to talk about that piece, I think, in the next part. So here we go. Harm reduction, accessibility to, as I said earlier, any kind of harm reduction material is still really difficult in 2014. So now some of the 40 recommendations for change have been implemented with a lot of work. like condoms, dental dams, and lube are supposed to be available, and I say supposed to be, in all the prisons in Canada, whether that be detention centers, provincial jails, or federal jails. The reality is that that doesn't always happen, and it doesn't always happen consistently. So today there may be some condoms available, but there's no lube. Tomorrow there may be no condoms or lube. The next day there may be just lube with no condoms. Like it's still haphazard, and there isn't really a lot of watchdog, eyes on the subject. We hopefully hear from people, and people let us know when things are not available so that we can advocate around that. But it's a constant struggle. Then there are the things that are completely invisible. Any kind of drug use paraphernalia is still considered contraband. So you can be charged for having a needle in your cell. So, and that makes drug use, of course, go even more underground than it is out in the community, and means that people don't have access to any kind of safe injection equipment. So there is such a thing in the federal prisons as bleach distribution, and we call bleach distribution passant the red herring, because the reality is that we know perfectly well that when you're in prison trying to hide what you're doing, trying to move really quickly, and that a single syringe is going to be used by 50 different people over a 6-month period, bleach is kind of a waste of time. I mean, it's we try to tell people, hey, it's better than nothing, use the bleach, it's important to do that, but the reality is that it's not really going to be very effective specifically against hepatitis C, so we need to think about those things. So what we've tried to advocate for, and what we try to talk about a lot, is that the care needs to be comparable at least to what's available out in the community. And certainly there are nurses and doctors who care and go in and really want to make things better for people inside. That's absolutely true. And the restrictions of a law and order kind of mentality, and the restrictions of institutions that really put security first above all else mean that getting access to medications is not always an easy thing. So if I go out to court today, my meds may not follow me to court, and I don't get my medication today because I was in court all day, and I come back and then maybe I get it at night, but I've missed a dose already, or these kinds of complications, or I get switched from institution to institution and my med chart doesn't follow me as quickly. So these kind of huge barriers continue to happen. So it's just really important for us to think a lot about how we advocate around these pieces and how we struggle, and how do we actually, we talked about partnership before, how do we actually work in a prison system where we need to be able to get in to see people, we need to be able to have people be able to come down from their range to see us. We need to be able to accept their collect call. They need to be able to get to the phone to call us. How does that happen when we're activists? So it's that balancing line of ensuring that we are respectful, that we are professional, but we also are really clear where that line needs to be drawn, and that we're absolutely there. We don't want to get banned from going into the prison, because that certainly has happened over passant's history. We've certainly been banned on numerous occasions from getting into different institutions, but that is ultimately the work that we need to do, means we need to be able to get in. So we have to find that balancing line and continue to work with that line, and it becomes the partnership that Gary was talking about earlier, about how do you find a way to, who has the real power and control. It's going to be the prison system. So is litigation our only option? Sometimes we think it is. Sometimes it absolutely is. And currently we're working in partnership with the Canadian HIV/AIDS Legal Network to litigate around needle exchange. So that's also, the Canadian Aboriginal AIDS Network and CAIDI are also involved in that litigation. And that has caused a lot of problems for all of those organizations involved. Because as soon as you start litigating government, your funding is in question, right? So things for us to think about. So we kind of consider ourselves a hybrid organization, service providers and activists. And what that has meant for us, and I talked about this a little bit earlier, is it means less access to funding. It means less access to community supports. It means difficulty gaining credibility. We are sometimes seen as the wingnuts of the AIDS movement, and we get that, right? I remember going back to the office after a meeting once where we had just become, gone from being a collective to a hierarchy. And I was hired as the first executive director at PASAN. And I went to this meeting, and the staff came up to me after and said, so people like see us now differently? Do they see that we're a different organization? Do they get, you know, that we're not wingnuts anymore? And I said, no, they just saw me as the chief wingnut, right? The reality is that we are who we are, and that's okay, right? And in all of that, we have huge support. Like, I don't want to pretend, you know, we have great people who we work with out in the AIDS community, in the prison community, and in the poverty activist community. Like, we're harm reduction communities. Like, we really find that those connections keep us alive and keep us stable. But, you know, we're a little odd, right? We're a little different. So we need to work together. We've seen how important it is for us to work together. We can't survive alone, and we don't want to survive alone. We need all of you to be able to do the work that we do. And hopefully, that reaches the people who it most importantly affects, those the people in prison. That's what we need, right? That's what we always need to be thinking about. It's the people that are inside that we actually need to be thinking about. How do we best meet their needs and are there for them? This is our fight. This is a fight that we really feel is important, because as much as I would prefer to have somebody who was a prisoner sitting here doing this talk, the reality is that their access to microphones are incredibly limited. Speaking out doesn't mean that people don't speak out in prison, they absolutely do, but speaking out has huge consequences. And you know, we have volunteers inside who are doing amazing work getting out the word about how to protect themselves and supporting others inside who are living with HIV and hepatitis C. But there's consequences for their actions. They are kept in prison longer, they are scrutinized more often, they're come down on harder around all kinds of restrictions. So I really feel like we need to think about how to support them better. There's a million things I wished I would have had time to talk about, so I just listed a few of them. I knew I wasn't going to be able to get to them all. I just want to take a second and say that prisons are getting bigger, they're getting more complex, they are becoming industry, and so that's important for us to think about when we're thinking about what that feels like and what that looks like for people inside. It's really important to use statistics to as is in everything around HIV, to our favor, to really talk about what's happening. So for example, and unfortunately, I talked about the numbers of people living with hepatitis C in prison. The numbers for people living with HIV are tenfold what they are in the community. These are huge, crazy numbers. Indigenous folk are about 3% of the Canadian population. They are 20% of the prison population. So we really need to think about and look at the prison issues and the racism that breeds. Racialized communities, again, usually make up about 3 to 5% of the population, and we're talking about 12 to 15% of the population inside. So huge, huge numbers. So how do we work with all of this? We do it together. We can't do it alone. And that's it. Thank you.